Hey, it's Hannah. Hannah Baker.
Holy shit.
Hello, my name is Hannah Baker, and this is my journey of why I got HIV. Don't worry, I'm not going to go and list 13 reasons why, but I will tell you there's definitely more than one. Where do I start? I'll tell you that HIV is wrong, and it's like the worst thing in the world. It stands for the Human Immunodeficiency Virus. Big words, right? Well, let me tell you why you should care. This is a communicable disease that infects your entire immune system. I'm talking kaboom. It totally destroys it. HIV broke out in the 1970s and it spread like wildfire. Everyone was being infected at the time. The disease attacks your T cells and it transforms your entire insides into virus factories. And of course, without proper treatment and care, the disease can eventually destroy you. And this is why you need to know. Today as you breathe, 1.2, that's right, 1.2 million Americans are living with HIV, and 1 in 7 people do not even know they have the disease. Now you know something new, you feel a little educated, maybe you even feel immune. Well, let me tell you, you're not at all. Let me tell you my story and get straight to the point. No one has time for these 13 tapes. You know, I had sex. And we didn't exactly use a condom. It was a last-minute decision, unplanned, and it lasted a minute. Maybe 2. I don't know, I wasn't counting. But I do know that and that alone was the worst decision I've ever made of my entire life. Do you remember your sophomore year? Because I don't at all. I don't remember my communications class, and I don't remember my bio class with Mr. Clay. He was a Christian with deep-set beliefs. His face got red whenever he introduced the topic of sex education, which is not required in the state of Wisconsin, by the way. His message was very, very simple. Do not have sex. The best thing to do is practice abstinence, and only when you are married should you have sex. I mean, come on, is he serious? But he wasn't wrong. What I recently learned before making these tapes is HIV can be contracted just about anyway. I mean, it can be contracted through unprotected sex, contaminated blood and transfusions and transplants, and from mother to child when pregnant, and shared from injecting equipment. No one is immune, and certain people aren't guaranteed to have HIV, just like you're not guaranteed to not have it. You're at risk if you're rich like Bryce, or if you're poor like Justin. You're at risk if you're gay or if you're straight, black, white, Asian, Latino, or Hispanic. You are at risk. You might be wondering, how can you protect yourself and hope there are more ways than just abstinence. Don't get me wrong, abstinence is the only surefire way, and it's also known as a form of primary prevention. Big words again, right? Well, let me break it down. Primary prevention in relation to HIV is educating people about the risk of sexual behavior, such as the subpar job Mr. Clay gave me. Secondary prevention includes things like condoms, something I wasn't aware about, but also thanks to Mr. Clay. Size may matter, but no one is too big for safety, that is. Tertiary prevention is what is allowing me to make these tapes in the first place. It's seeking out aid and receiving treatment from HIV care providers to prevent premature death. Now let's get back to the story. There was the sex, the high school graduation, prom, and all of that. Now it's my first year in college, and I'm walking down Library Walk. There are what feels like a million students in booths, and what pops out me is a poster that says, free testing. As a broke college student, the word free drew me in immediately, and I have a feeling that this sentiment resonates with those of you watching as well. I walk up and learn I'm at risk of having an STD, a sexually transmitted disease, and I think back to that fateful night. Hannah did get HIV, but don't worry, she's fine, she got treatment and she's good. Now, let's talk about epidemiology. Intersectionality plays a key role in the health disparities we face, such as our SES, race, gender, and sexuality. Generally speaking, men are more likely to have HIV, but women are more likely to die from the disease due to a variety of factors ranging from lack of access to health care and to stigma. Of the women diagnosed, African American women are more likely to contract the virus and die. African Americans account for 45% of diagnoses, while Hispanics and Latinos account for 24%, and whites make up 27%. Although HIV has decreased in the United States overall by 19%, it has increased by 6% among all men who have sex with men populations, with even sharper increases within the African American and Latino communities. If this continues, 1 out of 6 men who have sex with men will be diagnosed in their lifetime, including half of blacks and a quarter of Hispanic and Latinos, with only 1 out of 11 white with men who have sex with men.
Let's talk a little bit about health policy. Considering government and legislation, the Affordable Care Act has made huge steps in equalizing health care. The ACA insists on comprehensive quality care that insurers not be allowed to turn away customers with pre-existing conditions such as HIV, and that prescription medications be more affordable through discounts. Groups like the CDC, the Ryan White HIV/AIDS program, and the Henry J. Kaiser Family Foundation provide strategies and funding to combat HIV, as well as support and treat individuals whether they are insured or not. Goals of these groups and government actions are to prevent, care, and treat HIV, to improve access to care in the lives of those living with HIV, to reduce health disparities and inequities, and to coordinate the national response to the HIV epidemic.
The healthcare system still has a lot of room for improvement on educating youth. Only 18 states and DC require that contraceptives be discussed. 12 states require discussion on sexual orientation. A majority of those who are affected by HIV are men who have sex with men, and because 38 states are not required to discuss sexual orientation, and some also do not cover use of contraceptives, gay men and women are not given the information that could prevent them from attaining this chronic disease. 39 states require abstinence to be included in the curriculum. The simple fact is that people are going to eventually have sex, and half of the states are not covering contraceptives, which leaves students uneducated of options that can protect them.
So, what is public health? Public health encompasses a large web of interconnected topics, and when we think of public health, we see a working community that focuses on bettering the quality of health for all people through primary, secondary, and tertiary methods. Public health is broad in that it promotes healthy living, equity in care and access, and works to prevent health disparities among many things like quality treatment, health education, and research on health epidemics. But unlike medicine, public health focuses on the community rather than individuals. Their main aspect is to save as many lives as possible.
What is public health to me? Everything. Now, over here. Public health is improving the lives of people with laws such as seatbelt enforcement, restriction on smoking areas, and so much more.
Hey, to me, public health is people coming together to learn so that they can help themselves and others.
No. Public health is ensuring that we can all live healthy lives and have equal access to health care and our surroundings, and promoting healthy behaviors and prevention. I mean, why go to the doctor when you can hit the beach?
Or just do all of those things.